Learn English with Muallimi Academy.
Good morning, John. It's great to see you again. How have you been since our last checkup?
Good morning, Dr. Smith. I've been okay, but I've been having some issues with one of my teeth. It's been bothering me quite a bit.
I'm sorry to hear that. Can you tell me more about the symptoms you're experiencing?
Sure. It started as a mild discomfort about a month ago. I didn't think much of it initially, but over the past week, it's turned into a constant sharp pain. It's in my lower left side, and it gets particularly bad when I eat something cold or sweet.
That sounds like it could be a cavity or possibly a more serious issue like an exposed nerve or tooth infection. Have you noticed any other symptoms like swelling, a bad taste in your mouth, or changes in the color of your gum around that tooth?
Now that you mention it, there has been some swelling, and the gum does look a bit darker. I haven't noticed any bad taste, though.
All right, let's take a closer look. I'll start with a visual inspection and then use some diagnostic tools to get a better idea of what we're dealing with. Remember, if you feel any discomfort or pain during the exam, please let me know immediately.
Will do.
I can see some inflammation in the gum around your lower left molar, and there's a visible cavity. The tooth next to it also seems to have some wear. Have you been experiencing sensitivity with this tooth as well?
Yes, now that you mention it. I thought it was just related to the other pain.
It's not uncommon for nearby teeth to be affected. We should take a full set of x-rays to assess the extent of the decay and check the condition of your other teeth. This will help us create a comprehensive treatment plan. Are you comfortable proceeding with x-rays?
Yes, that sounds like a good plan.
The x-rays show that the decay in your molar has penetrated deep into the tooth, reaching close to the nerve. This is likely the cause of your severe pain. The adjacent tooth also shows signs of beginning decay. To address these issues, we'll need to do a couple of procedures.
What kind of procedures are we talking about?
For the molar with the deep decay, I recommend a root canal treatment. This involves removing the infected nerve and pulp inside the tooth, cleaning the inner chambers, and then sealing it to prevent further infection. After the root canal, we'll place a crown on the tooth to restore its strength and function.
And for the other tooth?
The adjacent tooth can be treated with a simple filling since the decay hasn't progressed too far. We'll remove the decayed portion and fill it with a composite material.
Is the root canal going to be painful?
Root canal procedures have a reputation for being painful, but with modern techniques and anesthesia, most patients report that it's no more uncomfortable than getting a filling. We'll make sure the area is completely numb before we start, and I'll walk you through each step as we go.
That's reassuring. How long will the procedures take?
The root canal might take 1 to 2 visits, depending on the complexity of the treatment. The filling for the other tooth can be done in 1 visit. We can schedule them over a couple of weeks to give you time to recover in between.
Sounds like a plan. How should I prepare for these procedures?
There's not much special preparation needed. Continue your regular oral hygiene routine. On the day of the procedures, eat a light meal a few hours beforehand and avoid alcohol. If you're feeling anxious, we can discuss sedation options.
I might take you up on that. What about aftercare?
Post-treatment care is crucial for a smooth recovery. After the root canal, you might experience some soreness and sensitivity, which can be managed with over-the-counter pain medication. It's important to avoid chewing on that side until the crown is placed. For the filling, similar rules apply, but the recovery is generally quicker.
I'll be sure to follow your instructions. How can I prevent these issues in the future?
Good oral hygiene is key. Brush twice a day with fluoride toothpaste, floss daily, and visit us regularly for cleanings and checkups. Limit sugary and acidic foods and drinks, and consider using a mouthwash to help kill bacteria and maintain a healthy pH in your mouth.
I'll definitely be more vigilant about my oral care. When can we start the treatments?
Let's schedule the root canal for next Monday. We can do the filling the following week. How does that sound?
Perfect. Thanks for explaining everything so clearly, Dr. Smith.
You're welcome, John. It's important to me that you understand and feel comfortable with your treatment plan. Remember, if you have any questions or concerns before or after the procedures, don't hesitate to reach out.
I appreciate it. I'll see you next Monday.
Great. See you then. Take care. And remember, good oral hygiene is your best defense against dental problems.
Got it. Thanks again, Dr. Smith. If you enjoyed this video, please like it and subscribe for more similar content in the future. Thank you for your support.